Hi, my name is Casey Arbuckle, and these are my answers for the Unit A theory assignment. So number one is, without using any nursing theory or professional approach, what are your initial thoughts about this patient and his family? What are some natural biases you had, and are they based on fear? So one of my first initial thoughts was how he talks about that he says, I sometimes think that I'm God, I sometimes think that I'm Jesus or that I'm Buddha, and he kind of, I don't know, he seems like he's more self-aware than I would guess him to be. Maybe like he kind of knows that he's schizophrenic, but maybe loses himself in it sometimes, and maybe he knows what's going on a little bit more than you'd think. um Another thing for me was that he lived such a normal life for a good portion of his life. He was middle-aged when he kind of started living the life that he's living now. He used to be an exceptional filmmaker. He was a family man. He had a wife. He had kids. It wasn't until he had one of his sons that he kind of flipped a switch. I was kind of curious about that. I wish they talked about that a little bit more as to maybe why he flipped a switch. Maybe it was like he didn't adapt to the birth very well. Maybe something else changed in his life. I'm not really sure, but I thought that was interesting that he lived such a normal life for so long, and then everything just kind of flipped upside down for him and his family so fast. So initial thoughts on his family. I feel really bad for them. I feel sad for them. You can tell that they still really love him, that they still think of him as their dad in a way, and they want to go find him and bring him back home, but he's gone, and he's not the same person he used to be. In a way, it's probably like he died just because he's not the same person, but it maybe makes it even harder that he is still alive and that he's out there living a whole different life without them. It just would be really hard. I can't imagine. Some natural biases I had. I thought this sounded bad, but one of the first things I thought is maybe that it's good that he's on the street. I have a bias that maybe he's dangerous, that maybe he's harmful to others, and I know this is a big stigma on people with mental illness, is that people are scared of them even when they're not really violent. They're scared that they would be violent or harmful. And his family talks about how he held them captive for a long time and they could only eat corn, and his wife was down to like 85 pounds. I think that would be terrifying. It sounds so scary. And so are my biases based on fear? I would say yes, out of fear that he would harm his family again or hurt others. But it sounds like he's out there living his life. It doesn't sound like he's hurting anybody. It doesn't sound like he's violent. And so I do understand why maybe that's a big stigma on people with mental illnesses, is when they act irrational for something small, it can change how you perceive them forever. And then question number 2, utilizing 2 aspects from the selected nursing theory, how would you approach this individual if they were admitted to your facility for a medical condition? How does understanding aspects of a theory change your approach? And does education change this? So I did Skinner's behavioral modification theory. So the first approach I would use would be rewarding positive behavior. So maybe finding something he likes to use as a reward, or just using verbal positive affirmations to help just reward his positive behavior. And then secondly, I would punish his negative behaviors through maybe scolding him, disciplining him, or even ignoring his inappropriate behaviors. This method changes the approach in that I wouldn't really be trying to understand his thoughts or find like the root cause of his behaviors, which would maybe be voices, delusions, hallucinations from his schizophrenia. And so I would be trying to change more of his outward behavior, how he's displaying himself, versus the way that he's thinking. And education changes this because we learn that schizophrenia is a mental illness, and so he can't control his delusions, his hallucinations. He doesn't really have a say over that. I think it can be helped, but those thoughts just are kind of embedded in his mind. He can't do a lot about it. I think education helps us to realize that it's a mental illness, it's a disease. And then number 3, was this theory effective? Why or why not? Was the recommended theory both age and developmentally appropriate? I don't think it was effective because it doesn't help the root cause of his actions, like I said. It would work better on maybe a child, someone that needs to change their behaviors, which would help them to change their way of thinking or their thoughts. But this wouldn't really work on somebody with a mental illness. So I don't really think it's age or developmentally appropriate for him, because I think he needs more of like good medications, therapy that would help him to understand and organize his thoughts more, which would then probably improve his behavior overall after helping him and treating his schizophrenia. But yeah, those are my answers to the questions. Thank you.